allow others to join the program. And I think we can start now so that we're able to make good use of our time. So you are all welcome. We appreciate your presence at this event. I am Fumi Ogunbiyi. I am the president of the Executive Diamond Ladies Alumni Group. And I'm going to be talking to you briefly about the Executive Diamond. What is it all about? When we talk about Executive Diamond is a weekend out program. They organize a weekend out program, which is like a getaway program in Lagos, Nigeria, for leading professional ladies and women train and workshop to rediscover themselves. So it's a 360-degree program for women discovery. And this program started in 2022. We've had 3 different co-ops program now. We started in 2022, we've had 2023, 2024, and we're going to be having the 2025 shortly this year. This particular platform was created by the visionaries Anna Oyebanjo with her associate BC Bitayo and Titi Ashiru, and this has been a life-transforming event. And there has been an event with different laudable speakers doing great things in their various spheres of influence and imparting lives and the rest. These are pictures of the different engagements we've had at the different sections we've had so far. It brings about networking at a very high level for all the executive women. And because we know that we thrive with ourselves by connecting with ourselves ultimately. And the another program that is also being championed by the Anna Oyebanjo and Associates is what we call the Silver Liners. What is it about the Silver Liners? It's a platform and forum for young managers that are in their early or mid-career in order for them to rediscover themselves and groom them for a position of leadership. And we've had different engagement with the session started in 2024. We've had 2 sections in 2024. And Picture Speaks, there has been a platform where renowned executives have been invited to come and groom these middle level ladies ultimately into a leadership role. This program is still going to happen this year for the Executive Liners program. It's going to happen in May 15 and 16 this year. And the Executive Diamond Women Ladies Out is also going to happen this year, October 24 to 26, 2025. If you are interested, I will enjoy you to just drop your details in the chat room. This particular program is brought to us by the Executive Diamond Ladies Alumni. So after you have attended the Executive Ladies program, you become an alumni of the program. And we've had different events, Picture Speaks, different events so far. We've had, these are the pictures of the different flyers of the events we've had. You are welcome to join the program in order to be part of the alumni and enjoy these creative, innovative sections that we've had so far. Then you are welcome. This particular program, as is being titled, is the mental health, and specifically is navigating the vulnerability and changes around women. So you are welcome. It's going to be a life-transforming encounter with our guest speakers, renowned guest speakers that are well educated in their different field of influence. I'm going to briefly introduce our moderator. She is Ifeoma Margaret Ikaekonwu. She is a dedicated and experienced HR professional with over 15 years of cross-functional experience in manufacturing and service industry. She holds a BSc in Business Administration, a Master's in Industrial and Labor Relations, and a professional certifications from ACIPM. Known for her disciplined, ethical, and approachable nature, she has held various roles with BOA Group since 2008, including HR management, store supervision, and a prestigious position as Senior Confidential Secretary to the Chairman. Currently, Ifeoma serves as the Group Recruitment Specialist at BOA International Limited, where our passion for human resources development continues to thrive. Our consistent performance and commitment have earned her recognition and including the best employees of the quarter. I hereby welcome Ifeoma to take on the e-mic from here. Thank you. As she navigates us through the program. You are welcome, Ifeoma. Thank you.
Thank you, Ifeoma. Thank you so much. You are welcome, my viewers. This is a program we've been long awaiting. Yes, we want to start now. Just as she has introduced myself, that my name is Ifeoma Margaret Ikaekonwu. Thank you, Ifeoma. So without wasting much of our time, I'd like to thank everyone who has taken her time to attend this program. The Lord bless you. So we'll move ahead to introduce our first section. Our first section has to do with our mental health, navigating vulnerability and change. And this will be taken from the first special guest speaker, who is Nurse Bernice Olusola Aketi. Before I bring her on stage, I would like to introduce her so that you can know who we are introducing. Her name, as I said, is Nurse Bernice Olusola Aketi. Is a distinguished nurse leader and educator with over 30 years of transformative service in nursing. Currently the Director of Nursing Services at the Lagos State Ministry of Health. She is renowned for her leadership, innovation, dedication, and advancing the profession. She holds several academic qualifications, including her BNSC, MSc, PGD, and she is currently pursuing PhD. Her impactful career includes keynotes at lawsuits such as Ward Manager and Head of the Surgical Department for Nurses, as well as leadership in nursing research and ethics. She has mentored countless nurses through educational programs, WHO-backed training, and disaster preparedness workshops. As the NMSCN, that's the National Nursing Midwives and Council of Nigeria, Southwest Zonal Coordinator for NCPDP, for former president of the West African Postgraduate College of Nurses and Midwives. She has influenced nursing across West Africa, leading initiatives in curriculum development and professional advocacy. If you want to know her career, some of the achievements, she is a multi-award-winning fellow of several prestigious institutions. Nurse Aketi is also a published researcher with ongoing work in public health, communication, and disease prevention. Her vision, expertise, and passion for mentorship make her a trailblazer in nursing and a role model to healthcare professionals across the continent. Now, join me with a clap ovation to welcome Dr. Aketi, Nurse Aketi, rather. Thank you. You're welcome. You have the floor.
Thank you so very much, Ifeoma. It's a pleasure to be here this evening. And without wasting more time, because we have that limited time, I just need to quickly go into today's presentation. By way of introduction, we are discussing, please, Ifeoma, can still share the screen since I shared with you earlier. By way of introduction, we are dealing this evening on women's vulnerability to mental health. What a significant way of starting the, I would say, mid-year almost. Women have been the main focus in our society because of various responsibilities we do handle. This from childbirth to leadership to caring for the entire community and the nation as a whole. So today, women's vulnerability to mental health is a gender perspective on global psychological well-being, which needed to be considered. When we have it considered for all purpose and intent, it's going to help us better to navigate. Have a woman in the society or as an administrator, you have it in a better form. And today, we quickly look at what's some factors and some other related points that could be considered as what to be looked into in terms of why women are so vulnerable. Women are vulnerable, we all agree with me, because of our gender sensitivity, because of our hormone factors, and so many other factors in place. I'm still waiting for Ifeoma, if he's in the house, to share, because I shared this with her before now. And by way of introduction,
Are you not able to view my screen?
I can't view it.
You can see, I was seeing it, but
I'm
now it
sharing.
has come up.
We can't see the presentation. Maybe you unshare and then share again.
No, we
Okay.
can see it before.
Okay, let me off it from here because I'm trying to share when I didn't see it. Let me off it from here. So I continue by saying, by way of introduction, that mental health issues affect over 970 million people globally. And currently in the UK, the youth are really having the feed of it. So women are more likely than men to experience common mental disorders, such as depression and anxiety. Why? Because of our gender sensitivity, gender roles, inequalities, and to name it all, our psychological vulnerability. The highest prevalence of women, like I said, go through all these challenges. And so women has this affinity because of our societal roles, because of our external pressures, because women are prone to so many mental disorders. You know for sure that women carry things into their heart. Men are logical. Women are emotional. By that logicability, they take things with levity. I'm talking of men. But what happened to women? We take it to our heart. When we love with our heart. Our children, our husband, anything. And that's why we have women in administration as being the effective ones. Laoye is one of the examples that we can easily reach out to. And Ms. Laoye is doing a lot in the area of earth financing and the likes. Remember the other lady, former first bank lady. And today, we talked of Pastor Bimbo, late Pastor Bimbo Fine, and we talk of presently of Reverend Adejuma, to mention but few. So women, and I can tell you, Edie Oyebanjo is also a trailblazer when it comes to area like this. So many women are doing a lot. So why focus on women? Our focus on women is one, because of biological factors, hormone fluctuations. Our hormone, estrogen, progesterone, thyroid-stimulating hormone, and the like, they are functional at that primitive stage of reproductive era. But by the time we are advancing in age, we found out that this hormone, they started aging, just as we age in age and physical. What are the other factors that makes women to be vulnerable? Social determinants. Our social determinant of health in the area of gender-based violence is a factor. As a caregiving burden, poverty. Many women are the ones shouldering the responsibility of their home, and that has made them has really weakened them. How about cultural stigma? We live in an environment that they believe men should take the lead, despite what you possess. And so because of that, all this serves as a kind of barrier, a systemic barrier in the area of unequal access to healthcare, economic resources, decision-making power. Go to our decision table today, where you find 10 men, how can you get 2? At our Senate House of Assembly, we have only 4 women there. And the one that's ready to speak, it was being otherwise considered to be the violent one, because of our mindset in the environment we find ourselves. What are the key mental health conditions that women are vulnerable to? One of it is depression. Like I said, women love with heart. We pour our heart. We want to do anything now. We are serious. So go and see so many professors in some areas, especially in nursing today. Though nursing is a female dominated, but go and see so many areas, so many disciplines where women exist. You find out that they are really doing a lot. They are trailblazers. Because why? Because of the tenacity and our affinity to possess, to ensure that, no, we perfect this, we achieve what we're supposed to achieve. Another one is anxiety disorder, more common and often, and it's been underreported. Anxiety neurosis is the major cause that women go through. Don't let them know. We hide under discreets. We don't want people around us to know we are going through it. I've seen so many women, when their children are on sick bed, especially adult children, they will go somewhere and cry, but when they come to the bedside, they look as if women are wonderful. And as a woman in the house today, I celebrate you because the power in you is an innate power. Another one is postpartum depression, puerperal psychosis. It's not common now because of the proactiveness of midwife. Recently, we celebrated International Day of the Midwife. And it's one of the things that we advocate. Midwives are the best advocate you can call for when it comes to maternal care. PTSD, often than known, features in this are not but least eating disorder. When you see somebody eating persistently, know for sure there is a disproportionate effect in his or her life, especially adolescents. The vulnerability of the women population, they are mostly the adults that is adolescents. Why? Because of their body age. Women, once they are, our young ones, once they are 12 years to 18 years, they start looking, between that 10 to 13, they start looking at, I don't want to be big. And they are the one eating chocolate. They are the one that doesn't want to wash plates. They are the one that want mommy to do everything for them. Also in this era of virtual, their phone is usually accessible. They can be on that phone for 3 hours at the expense of house chores. So adulthood, they look about their body age, their social pressure. That time is when they are showing their beauty and the curves is coming out in a way, and the early marriage risk, most especially in the northern zone of our nation, Nigeria. How about pregnancy and postpartum? Women are vulnerable during this period. During COVID-19 specifically, women with cancer, women with pregnancy, they are always stay off the environment that can be easily contacted. Why? It was said that during pregnancy, immunity is lowered because the children inside of them is feeding on their blood and the like. So they are susceptible, and irritability is expected because of the new changes in their lifestyle. So elderly women, they're also vulnerable, and that's the mental challenges. Why? All the children have left the house. It's only you, and if daddy has gone again, you now be the only one, despite the gigantic building. And so loneliness, neglect, bereavement, name it, they are susceptible to their affinite factors to our women being vulnerable. There are so many things that we need to look at. Conflicts of various sorts. Domestic violence, trauma, displacement, loss, the susceptible women to this. But like I said, hormonal changes, when your hormone is reducing, you see some changes like your skin starts sagging. You see that your bone density is weakening, especially at the lower limbs. The blood supply to lower limbs is now reducing. And that's why we encourage that you wake up in the morning to do some few exercise so that your body's control or anatomy can restore to a certain level. You go in early in the morning or in the evening when that the light ray, the vitamin D supply is available. So if you don't do that, or you are always sedentary, you are susceptible to some kind of neglect. So women with special needs, high level of stigma, like I said, violence and exclusion. We have a system whereby in that community, if you don't give birth to male children, you are an outcast. Well, thank God for understanding now. Like I earlier mentioned, in gender-based violence and mental health, there's over 1 in 3 women globally experience this. Many women, most especially the narcissists, who normally neglect their responsibility and always want to cover it under a shadow with their grandiosity, with their lack of empathy, with their emotional instability. They want to transfer it and be manipulative to the, passing guilt at the women at their expense of their weaknesses. And so when you are going through this kind of a thing, you are vulnerable, and that vulnerability needed to be voiced out so that somebody can come to you. And that's why in Lagos State today, if anybody is going through such, we have a way of reporting such to Domestic and Sexual Violence Agency, and their number is 080 00 again then 6333333. When you call that number, it might be for your neighbor, it might not necessarily be for you. It will save somebody's life. What are the barriers to mental health care? Stigma. Because you knew already that I'm not feeling the way I should feel. If I should go and make it known, would they not? You need help. So stigmatization that, no, this one, the pressure, once you mention the word depression or anxiety or PTSD, you see people, the way people start castigate one another. So because of that, many people don't want to speak out. They don't want to go to the clinic. There's a wellness clinic now in Lagos State. Wherever you are, you must have a wellness center. Lagos State have done that effectively. That is the way I'm feeling, I'm not okay. But just to go there, even to open up, is always a problem because of the stigmatization, beg your pardon. Grandma wanted to reform me there. So economic dependence and low decision-making power. Many women, like I earlier mentioned, were the ones that are fending for their family and still not being appreciated. See a woman today wearing the best, but I mean, try you. That is my brother is doing. No, even know that is the woman that is doing it herself. So we believe that everything, when a woman is coming out brighter and better or showcasing what he possesses, is the brother. Most of that, often than not, is not so. Again, cultural norms that discourage help-seeking behavior. What are those? If you go, they will make jest of you. Those are the things that hinder women from coming out. And you now see them taking so many supplements or some unhealthy whatever that is also injuring their kidney or their liver, as the case may be. Rather than seeking for help, it's not so. So what in that intersectionality matter, women mental health shaped by overlapping identities in terms of where you came from, sexual orientation, migration status, disabilities, and to name but few. And what are the solutions and interventions that we should begin to look at? Because of my time. One, community-based support. Example is what we are doing now. We want to see how our women can come. And before this program, we have gone through some challenge, gratitude challenge. We also go through work. This Executive Diamond have been doing wonderfully well. They mobilize one another. How many steps did you end today? If you didn't end up to 10,000 steps, they will encourage one another. And we have one person among us that's always leading. I give kudos to that, my Executive Diamond lady that is doing that wonderful. So we are doing all this in order to help one another, that you should not die in silence. Come and join. In the course of joining all this early morning work, community-based support, you find a friend, you share with one another, and before you know it, your heart is lightened. Trauma-informed care integrated into health services. I'm advocating this. Is very, very needful that in our workforce, like we had in Lagos State, let's have a place, just like we have a crèche. We should also have this area wellness center where somebody can walk up during the hour, just like we have for some area that we can pray for Muslim or fellowship time. We should also have a trauma-informed care center that is integrated into our health services or our daily care. Education and empowerment. With this education, as we are having it this evening, it reduces stigma. It enhances your knowledge. It makes you to know that you can intervene because you have listened to somebody, your capacity is built. If somebody is going through such challenges, you should be in the best position to bring such a person to a limelight that don't die in silence. There's a hope for the living, or the tree that has been cut down. Policy reforms for affordable and accessible care. I can tell you that is where the area where we are primary on. WHO emphasizes that we should be able to have some policies down to the grassroots that can relieve women, especially. We found out that the maternal care is being handled, is not being handled properly. Everybody wants to come to the space, being called a doctor, a midwife, or whatever, and they are doing a lot of injury to, rather than relieving people of their attention. So in that wise, there should be a policy that reforms a reform policy that enhances good health care and as well as accessibility and affordability. Knowing fully well that paying through the out-of-pocket payment is not possible, and that's why Lagos State, I thank them again, they imbibed the national policy of NHI, in which we have a national health insurance. In Lagos, they call it LASHMA, where you can register with them and you'll be paying a token And they also involve capitalist system in which those that cannot pay for their care, some people are paying for it. So some of us are paying, we don't access it, but somebody is using that just to ensure that it's accessible and affordable. The inclusion of men in changing cultural attitude and reducing violence. This program we are having, I look forward to see that there should be a time where we call our men, not necessarily our husband, those are the CEOs and the like, we wrap all together, we share ideas. Some men are dying in silence. Some men are really dying in silence. So we should find a common ground because of their ego. They don't want to say it out. Find a common ground to bring them to one or two meetings of us. What are the call to action I want to suggest tonight? Normalize conversation about mental health. Normalize it. Give support to survivors and vulnerable groups. I believe after this meeting, ED will begin to think deeply that we should begin to look at some area that we needed to give support to them. You go there on Friday, on Saturday, you sit down with them. Some people are dropping their elderly at the old people's home and they've never looked back. Our system here is not like in an advanced country. Thank God for some homes that are coming up now, and we can go to such homes and render our help. Advocates for policy that address gender-based was already in place. She and he was at the time promoted, and we need to as well enhance the effectiveness. Then invest in inclusive intersectional mental health care system. It's not only when they come to the hospital that or to the psychiatric center they should be treated. We should begin to take it to them. Advocacy, engagement of various sorts so that they can come. In conclusion, I take away this evening that women experience higher rate of mental health disorders due to complex overlapping vulnerabilities. In terms of social, cultural, and economic factors like violence, inequality, stigma, intensify this risk. So we should begin to look at, for instance, let me bring it home. Iyabo Ojo was celebrated on the social media, but before then, she was castigated. Ashewoni, she doesn't, until they saw the outcome, and that is a resilient woman. A resilient woman wants to achieve an opinion that the generation unborn will be better for it. Many women face barrier to accessing care, but thank God Lagos says it's not like that. But how about our exteriors? They are having such challenges. Lagos State being a coastal environment, it has given the sitting governor the opportunity to improve the coastal care, the coastal area, whereby mental health, care is being extended. So we can begin to see how we can as well, be it to Takwa Bay or to any area where women reside, and begin to advocate for them, not only when we are in the urban center, precisely. Then we are addressing women's mental health, which require holistic, which is gender sensitive, and intersectional approaches on various sorts. Thank you for inviting me, because you invited me because you believe that, oh, this woman is good in this field. And the next speaker is also going to elaborate much more on this, because this is the best way to go, calling the expert to bring in the idea. I won't stop this night by not telling you that in my final message to everybody in the house, that protecting women's mental health is not just a medical issue. It is a human rights imperative. And so you don't have to be positive all the time. It is perfectly okay to feel sad. It's perfectly okay to be angry. It's perfectly okay to be annoyed and be frustrated. Most of the economic situation that we are all witnessing. More so when the children are no more and you are not hearing from them how they are faring. More so when you are lonely and every other thing seems as if you are not there. It's perfectly okay to feel bad. It's perfectly okay to be scared and anxious. But having feeling doesn't make you a negative person. It makes you a human. I cited that quote from Lori Dexton, and it's my pleasure that I'm given this opportunity to present. Thank you, and over to the admin. Good evening, everyone.
Thank you, Nurse Aketi. We so much appreciate that. That was impactful. I believe I can see some messages popping in. That was interesting. Thank you, Ma. We want to thank you for this few period you have used to daze us with this powerful topic. vulnerability to mental health. This is awesome. And I
Thank
know
you.
there will be questions and answer, but we will leave it for maybe 10 minutes after the second speaker had come in. So please, if you have a question in the chat box, you can either write it out, then we'll pick it from there. I will introduce the second section, which is from Dr. Olufunmilayo Akinola. So stageless. So listen, before I bring her on stage, let's know who this beautiful angelic woman is. So Dr. Mrs. Olufunmilayo Akinola is a chief consultant addiction psychiatrist with over 27 years of psychiatric experience. She was involved in the hospital community education outreach program, psychiatric rehabilitation, advocacy, and clinical practice. She is a fellow of an examiner of the National Postgraduate College of Nigeria, a NABOSH internationally certified occupational health and safety specialist, and ASUT's hospital administrator. If you want to know her again, she is Dr. Akinola. She is the current secretary of the Faculty of Psychiatric of the National Postgraduate Medical College of Nigeria. She is the chief consultant in charge of the Federal Neuropsychiatric Hospital Annex located in Oshodi area of Lagos State. Her passion includes mentoring adolescents and youths, speaking at seminars, conferences, traveling, and reading. So permit me, she's going to take us through menopause and mental health. So, you know, we are coming of age. We won't say we can't run away from menopause. Definitely, we have to talk about it so that we can know these measures to take. So I welcome Dr. Mrs. Olufunmilayo. You are welcome, ma. She there?
Thank you very much. Yes, I'm here. Thank you very much for that. I was actually blushing. Good evening, everybody. Thank you for this invitation. And I want to say a big thank you to the first speaker. Fantastic presentation. Well done.
Thank
And
you.
to take over from where she ended, she said, you're not strange. You're not a difficult person when you experience all these emotions. So what we say is, you have this emotion. You're angry. You want to put down they are anxious and all that. Acknowledge the emotions that you are feeling. You acknowledge it. Where is it coming from? Why am I feeling like this? So what should I do about it? You don't know what to do about it? Please ask for help. So that is what keeping our mental health stable so that we don't cross over to the other side. So you ask for help. Asking for help does not mean that you are weak emotionally or mentally. We know that nobody can actually do life alone. So we all need each other, particularly women. We need that support base. So this evening, I'm going to talk about menopause and your mental health, or rather, our mental health. So I'll quickly run through what menopause is. We know that menopause is like you press stop, you do a pause. So it's that stage in our lives when there's a pause in all these reproductive activities that have been going on since when some of us were like 10 years old, when all kinds of hormones had been raging in us. We started our periods, then there's pregnancy, post-pregnancy, and all that and all that. Now we get to this stage that all of that will come to an end. So menopause marks the end of reproductive years in a woman's life, and it stops permanently. So we must remember that it is a natural occurrence. When women get pregnant and you're now ill, some women are ill when they are pregnant, they vomit, some of them will have to go on admission for months on end. And the usual thing they will tell you is, pregnancy is not a disease. So you need to pull yourself together. Why is your BP going up, your blood pressure? Why is there sugar in your urine? Diabetes will come up and all that. So pregnancy is not a disease. And now we are saying that menopause is something that should occur naturally. But that doesn't mean now it doesn't come with some difficulties. So it is a result of declining levels of reproductive hormones inside of us, especially estrogen and progesterone. And these hormones are produced by the ovaries. And it can also happen prematurely after surgical removal or side effect of cancer treatment or a condition that is called primary ovarian insufficiency, where the ovaries will fail to produce the hormones that they're supposed to produce. So before we have this menopause, we have the period called the perimenopause. So it's getting ready to happen. Sometimes this takes about 10 years, a period of 10 years. I mean, that is an average. It's not compulsory for everybody. The average number of years is usually like 4 years, and most people will be over it. Some don't even feel anything, and the periods, the hormone levels just dropped, and their periods will stop. Okay, so it's usually during this perimenopausal stage that a lot of symptoms come up and people start having issues, and sometimes during the menopausal period itself. So what are these symptoms? I'll quickly rush through them because my time is short. So we have, I'm sure we all know it, hot or cold flashes, mood swings. So that's what we're going to talk about today. Insomnia, that is poor sleep. You stop sleeping, you just can't sleep at night. There's vaginal dryness, urinary urgency, and sometimes incontinence. So it presents in different ways. Okay, I have been mandated to put on can you see me? To put on my video. Okay, and sometimes there's dry skin, and I hope you can see me. And fantastic. So dry skin, some can experience heart racing, palpitation, headaches, hair loss, and sometimes the hair might actually grow. So, but we know that the most important sign of menopause is the irregular periods. It's to start with, you start missing it, skipping a period, a month or 2 months and all that. And for some, the period will just come to be heavier and it will stop completely. Some, it will be lighter. So, and like I said earlier on, they will cease after some time, usually after the menopause. So we are saying, when do you say a woman is actually menopausal? That is when the period has stopped for 1 full year. That's 12 months. If you can have a spotting or bleed during that 1 year, then the menopause has not started. So you have to start counting again until it is exactly 1 year, 12 calendar months. When you do not see any bleeding, no periods, then you say, after that 12 months, you now say this is menopausal. So you're in that menopausal stage. So like we say, the problem is low levels of estrogen. And we must remember that estrogen has a lot of effect on practically all the organs in our system. And that is where the side effects come because of the low level of this hormone. So it protects our bones. So when this level becomes low during menopause, that is when the bone becomes soft. And you see that it is advisable that women do not fall. So you need to take care of yourself. You watch the kind of shoes you wear, not high. Make sure the sole is not just smooth and straight, because if you fall, it can be devastating because the bones begin to thin out. So that means they are liable to break more. And because it also has a protective effect on the blood vessels against cholesterol forming and lining our blood vessels. So when this low level starts, then there's the likelihood that there will be more, because you look at some people, they're so slim, and that's when they have, they go and do their test and they say their bad cholesterol is quite high and it's lining all their vessels. I know somebody, her husband was so big and she was slim like this. The husband's cholesterol level was fine, but ours was not. So these are some, and of course, this leads to cardiovascular diseases. So that's why it is important that we all do our medicals. They used to say yearly, but now it's like we're advocating that every six months, go and do your medicals, particularly all these cholesterol level, your sugar level, and all that, because these things are silent killers and they affect practically all the organs in the body. So it can also weaken the tissues around the urethra, and that's why you see some people have leakages. So you start wondering, why am I leaking urine? And urine is smelling. Is there something going on with me? So these are all the things. And of course, this can lead to urinary tract infections, increase in it. But we must remember, it is a normal stage of life. Every woman will pass through it. And it's not that we need medical treatment, drug that yours, but some, they go through it easily. There are no complications, and some, they do not find it easy. But the important thing is know that it's going to happen. Maintain a healthy lifestyle as much as possible. Like we were told earlier, exercise. Living a sedentary life is bad, particularly in Lagos. We spend practically all our time. Either you're in traffic, you get to the hospital, work, you're seated all day, then you get back into traffic, you get home. So we must find time to take these exercises, even while you're at work. So do the things you can do, the things you normally send your office assistant. Get up from your chair, move, get to that cabinet, bring out what you need. Don't call your secretary for that. During your lunch break, you can walk around your premises. The idea is, even if you do these exercises, 10 minutes, you find time, blocks of 10 minutes throughout the day, you will have done your 30 minutes by the time the day ends. Okay? And of course, do exercise, eat well. So we do take our supplement, calcium, vitamin D. Remember the sun, that's a good source of vitamin D. And heart disease. So go and check yourself up. Know that all is well with you. And but if you do all this and there's no improvement, of course, you need to see your doctor. We can give topical estrogen in form of cream, tablet rings that can be put in the vagina. I talked about vaginal dryness. So there's pain during sex, and this causes a lot of problems within couples. And women don't talk about these things. There's nothing to be ashamed about. And it's a simple thing. Is that but sometimes you just put KY gel, or you put all these form of cream, tablet or ring, and it will get rid of the dryness and will also improve the leakage from the urethra. Okay, so there are some exercises that you can do. You can be taught to strengthen the pelvic floor muscles too, so that it will also help the urinary incontinence. They talk about hormone replacement therapy, but there's a lot of fear associated with that, because they have to rule out cancer. Remember, it's estrogen we're talking about, and make sure the woman is clear of any cardiovascular diseases, no risk in the woman's life of breast cancer, no family history. So there are all these things that will be looked at before hormone therapy, but most doctors do not give it because of the side effects. Okay, so what can happen? We are going to our mental health. So that's the physical symptoms that we can have. And we know that we can also have effect on our mind, our mental health. All that I have said, even the physical health. And as we get older, apart from menopause that happens, people to start to have physical illnesses. And this can be a time of burden. People are worried. So all these stages, new things are happening. Children are leaving home. So it's either you're now alone, children are getting married, there's financial issues, what's going to happen to me? I'm entering retirement. Did I plan well? So there are lots that goes on during this time in the life of a woman. So we know that the incidence of depression can actually increase during perimenopausal stages and even menopausal stages. But one thing that research has proved is that menopause really cannot be the major cause of depression in a woman. It doubles. So the idea is that is either that woman had previous episode of depression, so there's a past history of depression in that woman, or so that means there's a resurgence of the symptoms, or there's even existing symptoms that might not even reach diagnosis. Then the woman will enter into menopause and there will be a surge in all the symptoms of depression and even more anxiety. So it can actually increase the incidence but menopause can't be the only reason for depression in women. And so in addition, in essence, what I'm saying is that, the period we are talking about, it says it starts from like 45, age 45, but some people do enter menopause at 40. At the age of 40, it will just stop. The period will stop. No news, no anything, and they go on with their life. So we talk about from age 45 to like 55, and that's midlife. So we face a lot of stressors during this time. There's a lot of dealing with illnesses, either in yourself or in your spouse or in the children, caring for children, dealing with aging parents, navigating life changes. So all these two can contribute to depression and anxiety. But anyway, the bottom line is there could be increase in incidence of depression at this time. But we are saying that anxiety disorder really is not it doesn't really increase during this period. So what is anxiety disorder? When we talk about anxiety disorder, we talk about people having this overwhelming fear. They can't explain it, but they just become afraid suddenly, and it is overwhelming. And they start having palpitations, they start sweating, they feel they are going to die, their hearts will be beating, and extreme anxiety. And it's just like the world is coming to an end, and they have difficulty in breathing. And of course, when there's palpitation, the heart will start beating, and you hear your heart beating. That's not a normal occurrence. So these are symptoms of anxiety disorder. But we have different types of anxiety disorder. What I've just described, we call it generalized anxiety disorder. But what is common during menopausal period is panic attacks. And of course, this panic attack is exactly like that. There's this fear, people start shaking, they start sweating, and trembling, shortness of breath. That is significant. And heart palpitation, hearing your heartbeat. So, but we need to differentiate this from the hot flashes that women can have. Yes, you can have all that. You become hot, you start sweating, you start trembling and all that. But the most important distinguishing factor is there is no shortness of breath when you're having hot flash. So that means, if we're not careful, we'll say, there's increasing panic attacks or anxiety disorders during menopausal time. Okay. So then we must remember that anxiety can be triggered off by overactive thyroid gland, which is commoner in this age group. So in whatever we do, please let's just go see our doctor. It's always better. Go for a proper assessment. Let investigation be done. Then when we rule out, the result come out and we know, okay, there's no physical cause of all this, then we start thinking it could just be menopausal symptoms that is happening. People can have it bad. I have a friend that it was during our own period, perimenopausal, it was so bad. She was depressed, she had anxiety, she would come out of the bathroom, she would fall down and all that. They started thinking, is it that our house was demonized, or the demons were after her and all that? But it was just menopausal symptoms. And some, they just pass through it like a breeze. So you know that all of us were wired differently. So these are some of the emotional changes that we can experience during perimenopause and menopausal period too. You notice that you become cranky, you get angry easily, feelings of sadness. Where is it coming from? Everything is well with my world. My marriage is good, my children are doing well, I enjoy what I do, but that low feeling, low mood, and loss of confidence, you start wondering, because it affects, remember maybe I didn't mention it, sorry, one of the symptoms of menopause is brain fog. You forget things. You want to call cop, you don't even know what cop is. You'll be looking for cop inside your brain. Has it happened to anybody? I mean, the words will just disappear. Memory loss. associated with menopause. I think it's there somewhere. Maybe I'll still talk about it. Poor sleep because of hot flashes, the temperature. So women don't sleep well. And you can imagine the effect on us. Anybody, not just women. If you don't have a good sleep consistently, it comes out, it can lead to this depression and anxiety feelings. It can lead to memory loss because your brain is just not sleeping. If you sleep at night, that is when the brain regenerates, restore itself. Sorry, it is restore, not regenerate. So everything you've learned, it will be stored into long-term memory. Then you wake up in the morning and you're sharp and you're ready to take over the world. But when you do not sleep well, sleep is so important. I do not know how to overemphasize that all of us must learn to sleep well at night. So these emotional things that somebody agreed with me, memory loss. You just think you are going to dementia. Or is it that somebody's been haunting me? How can't you remember, for example, I wanted to save an American number. I looked at the number. I said, I'm supposed to put plus and something in front of these numbers. But for the life of me, I could not remember what. Okay, it's okay. So I went back to my call log. I went to look for somebody's number that lives in America. Okay, I'm supposed to do +1. Simple. I will not stress myself. And like we say, I will not go and come and kill myself because of menopause. So all of us remember it's supposed to be a normal time, end of one phase of our life and beginning of another. So let us remember, make it as, don't get all worked up. And because when you get all worked up, that's when all these emotions will come. You become depressed, you become anxious, and you're making the situation worse. So seek for help. That's the bottom line. Don't keep things to yourself. So emotional symptoms, crankiness, anger, feelings of sadness, you can't explain it, loss of confidence, anxiety, forgetfulness, trouble, concern. You can't even, you're there. Sometimes they invite me, Zoom, I will get there, I'll be there 30 minutes, I'll be asking myself, what exactly are they talking about? Because my mind is just not there. So why waste my 1 hour, 1.5 hours? I just log out. If you want to talk to me, you have to talk to me face to face now. Or maybe I have Zoom meeting fatigue because we did quite a lot during the COVID era. Okay, so fatigue, you can explain. Fatigue can be caused by so many things. Please, let us get investigated. Don't keep these things to yourself. Go for your normal yearly or twice yearly medical checkup. It could be something to do with the liver. It could be, so don't stay there. I'm just feeling fatigued. You're not sleeping well. You will feel fatigued. I mean, it's just a normal thing. So mood swings. 1 second you're happy, you're smiling. The next you become very irritated with your husband. You can even shout at him. What? Then the man will say, what did I just do? Oh, I'm sorry, I was, So please let us seek for help early. So if you're having all this, it could be related to menopause. So let us get help, talk to people. Okay. So it's just about 20% of women that we have symptoms of depression during menopause. And one can have it at other periods. Okay, remember life situations too. And once you know that the things that used to come to you easily, to be able to plan, to execute, now it's taking you a while to think and plan and get things done. Remember, you might not be sleeping well, you're feeling fatigued. All these can be connected to menopause. So don't go down that way that there's something major wrong with me. Just go see your doctor, talk about these things. If the doctor cannot deal with it, let him or her send you to the mental health expert and, be able to put your mind at rest. So how can I cope with all these emotional changes? I hope I still have time. So what can we do? Manage our lifestyle. Everybody's talking about lifestyle changes.
Work-life balance.
Work-life balance. Let's learn how to relax. Don't take work home. If you drop dead at work, They're just going to stand maximum 1 week. Somebody else will be at your table. Sometimes they won't even wait until the person is buried before that post will be reassigned. So once you see, all of us must know the normal functioning of our bodies. It is our body. So you are supposed to know your body. So as long as something is wrong, you need to begin to ask yourself what is wrong and ask for help. It's so sad. I remember a friend now, she just called me out of the blue. She had been watching, because there's a family history of breast cancer. Then she noticed something last year for God knows what. She didn't go ahead to do a normal routine checkup about it. She knew that there was a change. There was a lump there. And now it has advanced. So you see the change, please seek for help. Let us know that really there's nothing. If there's something wrong, it is better to do it early enough. Early presentation, early treatment to prevent disability and death. Okay? So please let's know ourselves. And once things are not sleeping, you are groggy, you are just irritated, there's something going on. So what is it? Talk to somebody. So all of us must learn how to relax. We must learn to reduce stress. Don't take work home. People ask me, how do you cope as a psychiatrist? Please round up, okay? And I tell them I don't take my patient home. As I leave the hospital, I leave everything. I'm coming back tomorrow to come and see the patient anyway. I don't talk about it. Then I have other things that make me happy. So exercise, eat healthily, learn to meditate, breathing, avoid alcohol, caffeine, reduce your caffeine intake. Engage in activities that give you a sense of achievement and that make you happy. Stay connected with your family and community. Our social support is so important. All of us must continue to nurture our friendships. Okay? So remember, menopause is a normal part of life. Embrace the freedom that lies ahead. There's no chance of getting pregnant anymore. So you don't have to use fertility, whatever. So let's focus on ourselves. Let's watch what goes on in our mind. So we must replace those negative thoughts with positive thoughts. Seek help, like I said. Be in a good community, people that will, support you, not people that will pull you down. Okay? So let's remember sleep is important. Sleep is very important. So how do I do forgetting about my time is gone? So I've talked about difficulties. I've talked about how you can do it. You have a small jotter where you list all the things that you want to do. But if you sleep well and you don't overburden your mind, you will remember things. Okay, what about the weight gain that happens during menopause? That one, you have to watch it very well. So we exercise, you eat healthily, reduce the carbohydrate, but you can eat. I'm not saying you shouldn't eat, reduce it, balance what you eat, and don't put yourself down. Don't body shame yourself. It might be difficult, but it can be done. And just know that this is a period and you're going to overcome this time. So exercise, it can help us. So in conclusion, menopause can significantly impact our mental health, leading to various issues such as increased anxiety, depression. Okay, and we know that depression, the incidence can increase during this period. But the important thing is that menopause will exacerbate existing mental health problems, making it harder. It might make it harder to manage. So please seek for help. Then so we can manage all the symptoms through lifestyle changes, therapy, and other treatments. So there could be therapy, medication for the depression if it gets worse, then psychotherapy too. So let us learn to sleep well, seek for help. Don't keep things to yourself and reach out to others. Please don't struggle alone. So thank you for giving me this opportunity. I hope I have been able to change your way of thinking in one way or the other. So don't keep things to yourself. Don't struggle alone. Reach out. There is no stigma. People are going through all these things. And for some, it's easier for them to manage. They'll teach you what they did. So what's the shame about it? Don't let's continue to put powder and do this makeup and we are suffering in silence. Thank you very much and God bless us all.
Thank you. This is, in fact, wow. Thank you, Ma.
Thank you
We
for
so much
having me.
appreciate you. We appreciate you. Your teaching is so impactful. I believe we must have taken one or two things that we are taking home today.
Yes.
One, what menopause is. We learned about perimenopause. That's the entry stage. That vulnerability, please, women, emotionally, come out, speak up. Let's speak up. I think there is a shift in the world today, constant shifts that is making us to come out. Please, let's come out. Let's not die in silence, Ejo. Because this topic, I wish we could continue, but because of our time, we'll take few questions. Please, if you have a question, you can drop in the chat box. If not, I have questions for the two speakers, and I'll be so brief because our time is almost up. So, the key things here, let me see, fatigue, depression, anxiety. Oh, we should just be careful. We should watch out. Just as they said, we need to always check ourselves as a woman. Please always do that. You're routine drugs, make sure you take them. You see any changes in your body, please confide in your doctor. Or you come to them, the experts. They know what to tell you. They know how to guide you. So please, a lot of women out there is going through hell, but they can't speak up. The fear of unknown, the fear of, I don't know what people will say, the fear of, they will laugh at me. I think we have passed that era. We have moved on. Please speak up. Speak up so that we don't keep ourselves in the dark any longer. So my question is this now. Like I saw some of the questions on the chat box. This program, I don't know, we can extend it. I believe men too will have their question. I think maybe Grace asked this question. Why is there no program like this for men as well? Okay, I listened to a program on social media where the man is talking about postpartum, how men should help their wife because body has changed. Definitely, when you got married to this young lady, she was young, all her breasts were standing, curves are well. But after the first birth, you notice that a lot of changes has taken place. Either she added up, or she's now slow in action, or the way she talks, or it could be due to childbirth. You can lost one eye. Something else could trigger it as well. So please, let's speak up. I really enjoyed this topic. Edo, please, let's have this topic again, please. So my question goes this way. How do you manage these symptoms? I think, let me throw this question to the second speaker. How do you manage these symptoms? Knowing fully well, Lagos, for instance, is full of stress. You go out there in the morning, you come back, your business, your this. How do you put all these things together to balance your work life and then your mental health? Just 1 minute, ma. Dr. Akinola.
Well, I think information is the most important thing. Now we know that we need to take care of ourselves. So you do what you can do. No woman is a superwoman. Okay? So let us know that we're not super women. Then let's plan. Everything has to do with plan. So if you have to go to market, you have to do this. Lagos can be terrible. You can organize all the things you want to do in Ikeja today. Am I making sense? That everything, or maybe I want to go to bank, I want to do this, is in Ikeja or is on an island. Put everything for one day. Don't go there twice in a week. So you plan. The things that you can send somebody to do for you, you do it. They're going to steal. I really don't go to market anymore. Because when I was younger, I used to go to market, my 12. I will wear boots and all that stuff. I don't. They'll steal my money and let them steal small. They can't steal everything. But I have peace of mind because what I'm doing is a lot. I'll go to work. I have a private clinic. I'll still work. I'll do all that. So all of us, you must balance. And once your body is telling you you're tired, there are some days I don't go anywhere. I don't even leave my bed because I know I am tired and I know I need to sleep. So once headache comes, you can't remember anything, take a day off. They will say, it's because if something happens to you, that boss will get somebody else. Sending,
That's it.
Oga, today my brain is not functioning. I think I don't want to come down with anything. Please, can I just take a few hours off? So let's balance it. We are not super women. We can get tired. So let them steal it small. They will steal 1,000, 2,000. It's still okay. But if you pay the person well, the likelihood that she will steal from you will be reduced significantly. So let's manage our time, let's plan, and let's ask for help. I think that will reduce the stressors in our life, and we'll sleep well, eat well, and sleep well at night.
All right. Thank you so much.
Yes, you can get tired.
Okay. Thank you, Ma. I also have a question for the first speaker. Vulnerability has to do with change, emotions, like that. For these young couples now that are bearing more children, how do you think they can balance up this? Sometimes you're talking about stress, anxiety, depression, and all the rest. And there are some going through stress, but they couldn't say. Okay, for the little kids, how do they combine? Maybe you don't have a nanny, or you have a nanny, it's frustrating you. How do you combine all this? Because sometimes it's a whole lot of, for those, the younger ones, what do you tell them, Ma?
Thank you, ED, the moderator. The younger one should have planned ahead of time, but situation can call for, either as a result of relocation, death of a loved ones, and things like that. What they need to do is to organize among themselves. The ego of a man has to be pocketed this time around. Don't feel aware that a woman needed help, and once that help is given, it gives her a kind of emotional stability. Bathing of the children in the morning, preparing for their breakfast, for their lunch or whatever to take to school, and also the house chores. Men should learn to assist in that wise. So where they're having challenges, they can seek for a counselor or for help. It's not the time for a woman to begin to nag at home, because nagging puts a man off. It's about understanding one another. It's about showing more love. And not even only that, money plays a significant role in this early copulation. So what do they need to do before the marriage? It's one of the things they're supposed to have decided. How many percentage am I putting down? I don't believe in joint accounts, but a certain percentage from a woman and a man can make, a man cannot, and with this situation around us economically, you should not expect a man to be the one to put everything on the table. And like the Dr. Akinola just said, you should prioritize, buy things in bulk ahead of time, so that it will enhance your ability to manage your time. Time factor with the raising of children is of importance. And now as a career woman, making 3. And don't forget, your firstborn is your husband. All what they know is just get me my food. But always ensure that you, through humility, understanding, presentation, you bring it to your level, so that the two of you, because that time the love is still there. And you should not allow the love to sour, but through humility and humane way of relating with them, you can easily get things done. Don't forget, men are full of ego. The egoism of a man, we want to look as if, but when the understanding is there, and when you are in doubt, take up some books, read some books to assist where you could not get a coach. Go to YouTube. There's so many YouTubers that are giving useful informations about what you are calling above all, seek for help, get engaged, have family, friends, that even when these children wanted to go out at times, you take them there. Children love to go out, and they don't want to know whether you are tired or not, whether you are the CEO or not. All what they're after is their freedom, and should not deny them of such. So as a young couple, you can take this as an opportunity to learn more. And don't be like said, if you have a bad attitude, the rest assured you live your life alone. But people will run away from you if you are nagging type. Then you are the nagging type. Over.
Thank you, Ma. That's awesome. Thank you. I hope we've been able to achieve things this evening. It's a whole lot. Honestly, this is the kind of program we need. And if you know you have not joined the EDWO, what are you waiting
But
for?
excuse me,
Please
ma.
join.
I remember
Yes,
you asked before now about, I mentioned the future of a narcissist husband, that they
yes.
are very manipulative, they are they are high opinionated kind. They are the type that they believe they don't have emotional stability. And when there's a problem, they want to transfer the aggression to the woman. If you're such a man or somebody like that that is contributing to your stress, you should have some coping strategies, such as to set a boundary. That if I know this is how he or she behaves, you should find a common ground to avoid that from bringing up such arguments. As well as you should seek for support, as said by Dr. Akinola, as well as you should have a self-care, you prioritize your self-care. Today, look at yourself in the mirror. I'm beautiful, I'm bold, I'm honored, I'm living. Say that a lot to yourself. By the time you come out of it, you feel fulfilled, you feel encouraged. If somebody are ganging on and say a lot of things, it doesn't concern you. Just remain focused. If they are not ganging against you, that means you are nobody. But the time they are ganging you up to say a lot about you, that means there's something special about you, and that thing you must not let go. Again, you should have counseling session. Like I have my coach in the house, in person of my peers, Ministry of Establishment and Training. In fact, I cannot help me celebrate that woman in person of Princess Abisola Abidakun. That woman, Olusola Abidakun, that woman, she really played a lot of a role in my life. She was the only one that advised that and identified that, oh girl, you are losing it. What is happening? She brought me out of myself, and I'm happy for having such a coach in the house. Above all, evaluate your relationship. Osinachi is no more alive today because she was saying, let them, what would they say? If you're into an abusive relationship, seek for help and protect your own self. So evaluate it and begin to look through. Am I the one contributing to this? Or is he the one? Is he an external factor? If your husband has a side chick, does that concern you? Your life is one matter. Somebody once told me of how he identified that the husband has a side chick. And the man is also responsible at home. So she did not even find them. They had a party and she invited people. Even the lady was invited by the husband. Guess what she did? She prepared special delicacies for them. And they have a special table. But the bit of while they're enjoying themselves, she just called, as a woman, she just called on that lady and said, look, my husband, you might be going out with her. She's still my husband till tomorrow. The father of my children is Olowo. Begin to give those accolades. And I know you and him have been going out, but let me tell you, you're only ruining your future because it will not pay you for anything. That courage. I learned the lady did not stay long in that party, at that party, and she left with her friend shamefully. So we should begin to speak to yourself that your life matters. If you die today, that man will marry another person. Like I earlier mentioned, report any case of violence. Lagos State have his site. Just go to Domestic Violence and Sexual Violence DSVA agency. That is Domestic and Sexual Violence Agency. And their number is 080-00-33-33-33. Whenever you have such and you think you cannot continually coping with such, give a call to them and they will attend to you. Thank you for the audience. Good evening, everybody.
Thank you. That's another addition to what we've already gotten. Thank you, Ma. This is wonderful. All right, because of our time, if there's any other question, I will appreciate that. In absence of no question, but let me not add more because this topic is, if we continue, we might not live here today. It's interesting. And I believe if you have not joined EDWO, please do yourself good by joining. For our online viewers, those who are there, please you can just type in your email address. We'll send you the clips, send you the slides so you can join us. We have a program coming up in October 2025. Please do join. Feel free. These are for women. We are creating space for women to grow, to support each other, to heal so many things within us, because this discussion must have healed some wounds, must have healed some depression, must have healed some things in our body. Let's do ourselves good by joining, coming together as women to create this. Men, leave men outside this. This is ourselves. We want to talk about ourselves. It is not ourselves. Thank you so much. And let's say, because of our time, we are just 10 minutes behind schedule. So I would like to close here. And my closing remark is no woman is alone. No woman is alone. Vulnerability is not a failure. Menopause, fatigue, depression, anxiety, you have seen all what this causes in our body. Let's try to check up ourselves. Let's exercise our body. You see some women, they are weighing 100 plus. Oh my God. Exercise your body. This will help you. You check your cholesterol level, check your BP, your sugar level, because all these sicknesses, they don't tell you. But the little changes you are seeing within your body, please, if you don't understand, ask your neighbor, ask your fellow woman. They will always put you through and guide you. We have this exercise in the house. So if you are an Edwo, ladies, so that one is 100%, you have that. But for those who are joining us from other platforms, please do well to drop your email address. We'll send you and then we'll follow you up. So our program is also coming up in October. Kindly join. The flyer will be shared in your email. So I close. Dr. Akinola, do you have any closing remark for us? A take home. Just 1 minute, please, ma.
Okay. So
Thank you.
we can't do life alone. So please, we need that support. We are not men. Women can't do life. You can't do it by yourself. And don't go around saying that they will talk about me. They will do everybody. We all have one issue or the other. So please ask for help. It is so, so important. And let's take care of ourselves. Sleep well, eat well. And nobody can give you happiness. Make yourself happy with your creator. Thank you very much.
Thank you, ma. Then Nurse Aketi, your last remark for us.
Well, I said it when I was presenting that protecting women's mental health is not just a medical issue. It is a human rights imperative. And you don't have to be positive all the time. It is perfectly okay to feel sad, to be angry, to be annoyed, to be frustrated, to be scared, and to be anxious. Having this feeling does not make you a negative person. It just confirms that you're a human being. Live your life to the fullest. Thank you.
Thank you, ma. I appreciate everyone. The viewers, those who join us from other platforms, thank you for joining. And the Edwo ladies, thank you for your support always. There's no time we call on you that you are not always there. Thank you so much. But please do not forget our meeting again is October. Do not miss it. I don't know why I keep hammering on October because it's well loaded. Well loaded. So please let us also come together in October. I know with time, this program, even this topic, we've not exhausted it all. There will still be more topic where we'll talk about ourselves. So I want to say thank you for watching. Thank you for being here. We'll see you some other time again. Thank you and have a good and a relaxed evening.
Let everybody put on their camera and say bye-bye. Love you.
Okay.
Thank you.
Bye.
Thank
Love
you.
you. Have
Thank
a beautiful,
you so much, ma.
relaxing
Thank
weekend.
you.
Thank
Bye.
you so
Bye-bye.
much. Thank you. We learned a lot.
Very much.
Bye.
Well
Bye.
done, ladies. Proud
Bye.
of you.
Well done.
Olusola,
Bye-bye.
thank
Bye.
you.
I
Well
have
done,
I have
Aketi.
a friend from Sierra Leone that joined us. That's
Yes,
a
thank you
Oh,
very much.
Dr. Joan.
Welcome.
Ladies.
Thank
keep it
you.
up.
Thank
Welcome,
you.
Dr.
For
John. Thanks for
joining.
Yes,
joining
I had
us.
a good time with you, ladies. I've learned
Yeah.
a
Very
lot.
nice
So
topic.
much.
Well
Yeah,
done.
thank
All
you.
right.
Thank
Okay,
Bye-bye.
all
you.
the best.
Yes.
Bye.
Bless
Yes.
you.
Bye. Bye.
Bye.
Bye-bye.
Thank you. Bye. Bye.
Bye. Proud of you, Aketi. Always.
Hey, my coach. Thank you,
Well
ma.
done.
Bye. Thank
Yes,
Well
you.
bye-bye.
done. Well
Bye.
done.
Thank you
Bye.
so much.
Thank you.
Thank you.
Well done, all. Bye-bye.
Bye.
Bye.